Hello everyone, myself Dr. Geetanjali Sood will be presenting a video titled Trimming the Lily in the Eye. The surgery is done at SMI Institute, Kangra. This was a case of 60-year-old female with uncontrolled diabetes from past 30 years, who presented with drop in vision in left eye for past 3 months. She had never undergone eye screening before that. At present eye in left eye vision was perception of light with immature cataract and pterygium. Dilated fundus examination revealed advanced proliferative diabetic retinopathy with the fibrovascular proliferation resembling a flower in a pool of blood-filled vitreous cavity. Right eye had high-risk proliferative diabetic retinopathy and received pan-retinal photocoagulation. She received left eye injection antivascular endothelial growth factor followed by 23-gauge pars planar vitrectomy. During surgery we noted the vascular component had markedly decreased and the flower was white-looking. After core vitrectomy we identified the hyaloid plaque 60° around the proliferation. On doing that, the petals of the lily flower collapsed over the optic disc. The flower was attached through a fibrous stalk to the disc. Cutter was used to trim the flower at low cut rate and vacuum. The stalk was vascular and bled. We identified a second flat membrane along the superior arcades that was causing traction on underlying retina. The membrane edge was lifted using forceps without causing undue traction on retina. The bleeding stalk over the disc was cauterized and the bleeding vessel adherent to membrane was also cauterized before dissection. Then we did one hand scissor dissection of the membrane. Subsequently, cutter was used to segment the membrane and trim it to extent possible. The flat diffusely adherent membrane over the posterior pole was that lifted again using forceps and vacuum-assisted dissection. The bleeders were cauterized intermittently. And retinal photocoagulation was done followed by fluid gas exchange and silicone oil. This case presented two unique presentations of the fibrovascular membrane in a diabetic patient. The elevated stalk was flower-looking and the second scaffold of adherent membrane over the posterior pole. The highly vascular proliferation with stalk gave a unique appearance in this case. The greatest rescue in this case was preoperative use of antivascular endothelial growth factor that reduced the vascularity dramatically. Post-operatively patient did well with best corrected visual acuity 6/3/6 with cataract and silicone oil infusion.